Hi there, this is Mark Edelman, speech-language pathologist, and welcome to the teaching of talking. This particular video is about success and success in speaking better. You know, there are so many people out there who have aphasia and apraxia and a number of other speaking difficulties caused by traffic accidents, brain injuries, and the like. And many of them would really like to get better, and many of their loved ones, their parents or their spouses, also would really, really love to have them speak better. But there's been a problem. There are basically at least two or more problems. May I review them with you? One of the first ones is that if you have a particular goal that you have, then you must know what to do in order to achieve that. And one of the biggest problems in the field of speech pathology and in the field of caregiving for those with aphasia and apraxia is the fact that there is not really a whole lot of information out there regarding the techniques that really work to help a person speak again. And another one of the problems is that a lot of therapists and a lot of caregivers really don't take the time to research what it is that will help the person who's got aphasia or apraxia. So there is information out there, but one of the big problems is that many therapists just don't want to spend the time researching it. Now, they've gone to school and they've had to break their rear ends to get through at some universities. And then when it's time to graduate, many come out of school thinking that they have all the information they need to help a person talk. But believe me, I was in that position. And it took me about 10 or 20 years to really figure out what specifically to do to help people talk. I practiced, and that's what practicing is all about. Practicing is practicing techniques to help people talk, and many of them don't work. So one of the things that you must do, whether you're a caregiver or a therapist, is you've got to commit the time to research what exactly will help the person that you love or the person you're working with, what method, what techniques, what maneuvers will help you help them recover the ability to speak. But again, one of the biggest problems is a lot of people just don't want to spend the time. They just don't want to spend the time. Now, some people will say, well, you know, my insurance no longer pays, or Medicare, I reached a limit, and gosh, speech therapy is very expensive. And, well, maybe it's the money. Yeah, it's the money that it costs, and therefore we aren't going to do it because of the money. But that's not really true in most cases. In most cases, most people are not willing to put in the time. It's more about the time than it is about the money. It's about putting in the time to find a therapist, an expert therapist. It's about taking the time to see if the therapist who's working with you has techniques and maneuvers that are working. Because there's a lot of therapy being done out there that isn't working. Now, there's therapy out there that is too. Don't get me wrong about that. But it's the time to find a therapist that you have to make the time to find the therapist. You have to find the time to make sure that the therapist has methods and techniques that are working. And if they aren't, then you've got to find the time to find somebody else. And it's a matter of time. Now, there's something else that's very important for success in speech therapy, and it also deals with time. It's about, are you spending the time to dedicate yourself to learning what to do and applying what to do, whether you're a person with aphasia or apraxia or dysarthria, or whether or not you're even a caregiver? Because it takes a tremendous amount of time to master methods that will help your loved one talk. And if you're not willing to put in the time, then it's not going to happen. You may have the money, but if you don't have the time to interact and to learn what the therapist wants you to do and apply what the therapist wants you to do with your loved one, guess what? No cigar. It's not going to happen. Time. This particular video is about time. Most people say, well, it's the money. No, it's not the money as much as it is the time. It's the time to find the therapist. It's the time to make sure that what the therapist is recommending works. And if it's not working, you've got to find the time to find an expert. I mean, a true expert who knows what they're doing, who will teach you what to do. But then again, even if you have the money, you have to spend the time with the expert, then the time with the person who has aphasia or apraxia. And if you do that, you'll get results. And what I've seen through the years, throughout basically a general picture, is that it's a small minority of people who truly get better. And those minorities of people who get better are the ones who are spending the time finding the therapist, spending the time making sure that the maneuvers and the techniques are right, and then spending the time with the therapist, learning what to do and applying those maneuvers, those techniques at home with their loved one, or the therapist with their patient or client, each and every interaction. So that's what this video is about. Success in speech therapy, well, it's more a matter of time, and time is of the essence. So if you've liked this little video, just give us a thumbs up. If you haven't subscribed to the channel, please do so. And if you really are serious, because I know a lot of people who I've seen who say, well, Mark, I want help, and I see them, and then the next week, did you do what I asked you to do? Well, we had a death in the family. Oh, well, we had the plumbing that needed to be fixed, or we had to call in the exterminator. And what happens with some people is they have every excuse in the book for not putting in the time, and you got to put in the time. So I hope that you've learned that you got to spend the time to find a therapist. You got to spend the time to make sure the therapist is getting results. You got to spend the time, if you want your loved one to really get better, you got to spend the time learning what to do at home to help them. Because these problems take a year, 2 years, 3 years or more to really get significant improvement. There's no magic wands here. No magic wands at all. So we hope you've enjoyed this video. Beneath the video are a bunch of links that you can find me. Send me an email. Tell me that you want to meet with me for a free initial consultation or a get acquainted session, and we'll chat, and we'll figure out what to do to help your loved one. But remember, time is more important than almost anything else in the recovery of speech and language. It's the time. More so than the treatment, the technique, the therapy, all of that. Those are all important, but you've got to put the time in. Whether you're a therapist, whether you're a parent, whether or not you're a spouse. And if you're not willing to put the time in, don't start, because you'll just waste your time and money. And we don't want you to do that. We want you to be successful. We want you to be happy. We want the person with aphasia or apraxia or dysarthria to recover their ability to speak and not be a person that's kind of off in the corner of the room being ignored. We don't want that. So you got to put the time in. This is Mark Idelman, speech-language pathologist. Hope you've enjoyed this little video. We look forward to seeing you further on down the road. Don't forget, underneath the video are a bunch of links. Contact me. I'll help you. And that's all I got to say, other than I hope you have a wonderful day today, a wonderful evening, a wonderful week ahead, a wonderful month ahead, a wonderful year ahead, and a wonderful life ahead. Bye-bye now.